Hi there, folks. This is Dr. Ellenburg. Welcome to my show here on Fox News Talk, 1020 AM, 95.5 FM. You also find us online at foxnewskoan.com. That's foxnewskoan.com. As a reminder, during the week, you'll find me, of course, at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. That's 563-2366. We have a website entitled drellenburg.com. List of our services. We have archived radio shows on our website. We have a list of websites you might find interesting to read and learn more about what things different in the world can affect your health. Have a also list of books that you might find interesting to at least get titles down as far as purchasing to learn more about a variety of therapies that can help you with your immune system. Again, it's drellenburg.com, and that's DR, doctor for short, and Ellenburg, ELLENBURG.com. You also be happy to know I do see patients in the Kenai, Soldotna, and also in the Palmer areas. To find out dates and times, give our office a call at 563-2366. All right, folks. Well, today I'm not going to have any troubles with my show, specifically as far as my materials. Last week, I was unable to open my document from my iPad to read my show. Thank goodness for a good memory. I've gotten most of it. However, I'm going to review a few things we kind of glossed over kind of quickly on last week's show because I have more detailed information about that. As far as our main show for today, we're talking about a variety of things, of course, with cancer. We're talking about vegetarian versus a meat diet and cancer, talking about how berry consumption could possibly lower the risks of age, cognitive decline, in this case dementia, decreasing dementia risk, talking about how an acid versus an alkaline diet may help your body out. A recent study demonstrates the use of it in kidney disease, being a positive for having a more alkaline diet. We will also talk today about a new topic, which I'm learning a little bit about as we go along, called nanoparticles in food. Many things where our food's packaged in these days, and a variety of things are what's called nanoparticles, things like copper and silver, for example, to name a few that might be found in food packaging and wraps that are used typically a lot of times to decrease antimicrobial or things growing in your food. And we'll talk about the implications of that and what that means for us for long-term health issues. I also want to have an article today to discuss the use of omega-3 fatty acids and the use of postpartum depression in women who've had children and are suffering from depression. And I'll also talk today about another article that came out talking about the usefulness of healthy bacteria, in this case probiotics, in children may improve eczema. And we'll see how far we get from there. So quickly, let's kind of hop over today to talk about just some review of last week's show and what I think I missed on a few things I want to bring up. As I mentioned, I was at a conference called the American Academy for Advancement in Medicine, also known as ACAM, A-C-A-M. Their website online is acam.org. It is a group of chiropractors and naturopath doctors and MDs and DOs and nurse practitioners and even acupuncturists. It's a group, belong to this group together. And we get together a couple times a year with some great presentations on a variety of topics in medicine, usually very, of course, fact-based, of course, without question, with evidence-based medicine studies being presented as well, as well as clinical information from doctors who are presenting at these conferences. ACAM started in the early 70s with doctors who were doing chelation therapy for treating cardiovascular disease in this country, and grew out of that into what they have today, which is several thousand members. Great group. And they have the hosts, and the one this year was on gastrointestinal health and GI health, and there was a topic there specifically talking about, it was kind of off topic a little bit, talking about, statin drugs. And as you know, statin drugs, many out there of us take statin drugs. I do not take statin drugs, nor would I ever take statin drugs, but they're out there. Lipitor, Zocor, Pravachol, Vytorin, Crestor. Those are statin drugs, and those drugs are used to help lower cholesterol levels in patients. And some of the data on those drugs is quite interesting. And Dr. Stephanie Seneff spoke at ACAM this year and had a great presentation, and we have a couple of her nice little gems from her discussion. First of all, looking at some of the number of prescriptions that were written in the last year, just in this case, 2011. So they were the most common prescription drug written on a prescription for a patient last year at 355 million prescriptions. That is a giant number. It's actually more than people exist in the U.S., so they're obviously writing them a couple times over, or for different folks that live in the U.S. or whatever, because it's kind of an odd number, so it's a huge number. What was interesting is looking at an article from Journal of the American Medical Association, known as JAMA, 2011, and Dr. St grabbed an article here talking about how the Center for Disease Control stated that the occurrence of heart disease in the U.S. population remained stable over the last decade, while the use of statin drugs has decreased tenfold from 2% in 2001 to 25% over the last 20 years. Wow, longer than a decade. But the point is, they've gone way up. So we've got a massive increase in use in statin drugs. There's a big argument in the field who prescribe statin drugs on all sides as to their effectiveness and do they work? Do they actually do what they're supposed to be doing? Well, we know they're supposed to lower cholesterol, but are they actually improving cardiovascular disease? And that's the debate. I'm not trying to suggest anybody stop taking statin drugs at all. I'm presenting the information that's out there and about them. And a JAMA article, 2011, stated that we have a major increase in the use of statin drugs, but at the same time, the increase in heart disease has remained about the same. It hasn't gone down. So has it been really effective? Hard to say. I mentioned last week that an article was talking about all-cause mortality. That means dying from anything was highest for men and women when their total serum cholesterol is the lowest. And I have mentioned on this show several times over the last few years that once your cholesterol becomes too low, we have seen from previous studies that it increases your risk of infectious disease, increased cancer risk, and again, we have a study, demonstrate all-cause mortality is increased in women and men who have the lowest cholesterol, and that was in a journal of the Evaluation of Clinical Practice from 2012, a very recent one that was done. One other area that we're concerned with, and there is a very not well-known side effect from taking statin drugs that can cause periodic amnesia. People forget things. And this is hardly ever talked about. However, it can happen. And when we sit and think about, well, how could a statin drug affect the ability for you to have to remember something or lose your memory for that matter? And an important part to understand is getting back to cholesterol. And specifically cholesterol in the brain, here's a fact I didn't know, is that the brain contains 25% of all cholesterol in the body. Interesting fact. The brain contains a quarter of all cholesterol in your body. Okay? That means your brain is using lots of cholesterol for a variety of things, insulating pathways in your brain, kind of like an insulated wire, so to speak. They're called myelin sheaths that surround nerves in various parts of our body, also in our brain as well. And so, it's not surprising then to think about, well, if someone had, sporadic or intermittent amnesia by taking statin drugs, because it can happen, and there's reported cases of this, not just one or two, many. It makes sense because the cholesterol levels possibly are getting too low. So interesting. What are some other side effects that we can see with people taking statin drugs that have been talked about? They don't hear about very often. And the most common one we hear about with statin drugs that people are taking, again, if you're saying, what are statin drugs again? Lipitor, Zocor, Crestor. Drugs used to lower your cholesterol, but there's specific statin drugs. There are different drugs used to lower cholesterol that are not statin drugs. Okay, phenofibrates, for example, which inhibit the absorption of your cholesterol inside your gastrointestinal tract. But in this case, these drugs, statin drugs, work at decreasing the ability of your body to make cholesterol, and that affects an enzyme in your body that also is involved in making energy in every single cell in your body, and therefore can lead to fatigue or muscle weakness, which can happen on this drug as well. But also, we can see changes in patients' libidos. They can have weight gain. There can be an exercise intolerance. That means they can have, their fatigue, whether actually exercising where before they were not. It can affect kidney function. We mentioned memory today. It can affect depression and help worsen it. It can cause confusion and have trouble with your cognition or thinking. And in one recent study, that came out in the Archives of Internal Medicine 2012 this year, statins cause fatigue in 40% of women taking them in the study. That's a big number. That's a really big number. So, again, it's important to realize when you're being put on a statin drug, discuss it with your provider and weigh the risk and the benefits. because there are benefits and there are risks. And some of those risks you may not be wanting to accept as that. And the other thing they add into this note is that over the years, and I don't prescribe statin drugs. I'm a naturopathic doctor in the state of Alaska. Can't prescribe any prescription drugs in the state of Alaska at all. Washington State, Oregon, Arizona, if I was licensed there, I certainly could. It's a different story. But here in Alaska, I don't prescribe these drugs. However, I've been to plenty of conferences over the years where providers will talk about, mostly MDs, on how statins can be prescribed in a different way. And that is actually having patients take them even on an every other day schedule, a couple times a week. So consider that when discussing this topic with your doctor. Or if you're having side effects from statin drugs, you probably want to get off of them, okay, and try something different that's going to work for you. Work at really looking at what is the cause of your high cholesterol, okay? And as you know on the show, I tell you often, cholesterol is not the cause of cardiovascular disease, okay? LDL cholesterol, low-density lipoproteins, LDL cholesterol, called the bad cholesterol, there are subfractions of LDL cholesterol. Those are involved in cardiovascular disease. But, once again, discussing that model of your artery, think about the pipe, and you do a cross-section, look inside that, look in that wall of that pipe. Something has to damage the inside of your arterial walls to get cholesterol involved in the process, okay? So we could say that cholesterol does have an involvement in cardiovascular disease, but is not causing the disease itself directly. Something else in your body is doing that. Something else is harming the inside of your arteries, because what happens then is that cholesterol does get involved, LDL cholesterol, and it gets into the it's called the lumen, the intimal lining, of your arteries, and that is where then your immune system gets involved, and we have a laying down of calcium after a process takes place over a period of time, and you get a plaque inside the wall of your artery from cholesterol being involved in it. But consider those things when looking at taking statin drugs or not, and what else is out there. I do want to mention, we mentioned last week too about probiotics from the particular study where patients who were diagnosed with what's called Clostridium difficile with associated diarrhea that came from patients being on antibiotics. And their risk of developing that was decreased by almost 70% when patients were taking probiotics while they were taking antibiotics. Diarrhea is the most common side effect from taking antibiotics, and can be prevented, in this case, more often than not, it sounds like, by taking probiotics, healthy bacteria for your GI tract. I also want to mention one last thing from our last week's talk that we didn't get to, and that was discussion of different diseases being now associated with your bacteria inside your gastrointestinal tract. And the main one I'm going to focus on for just a few minutes here is diabetes, type 2 diabetes, and obesity. And metabolic disease has been talked about for quite some time in medicine, in the sense of how that can turn into type 2 diabetes. And our textbook discussion of what type 2 diabetes is where your cells that store glucose, in this case the highest areas being stored in your body, typically the liver, the fat, and the muscle cells, begin to not sense the signal from insulin to tell them to store glucose like they used to. And so what happens next is your pancreas has to take up more work and put out more and more insulin to tell these cells, the liver, the fat, and the muscle cells to store glucose. And eventually it stops listening, and glucose goes higher and higher. You begin having symptoms, like, for example, you're going to have frequent urination, have numbness and tingling in your fingertips, just feel overall lousy, you're hungry all the time. These are type 2 diabetes symptoms that can be going on prior to a patient being diagnosed with type 2 diabetes. That's kind of a textbook of how things look at this point in time. Metabolic disease is a condition where before we see type 2 diabetes, we start seeing things happen in patients that indicate metabolic disease, such as an increase in the occurrence of high blood pressure, an increase in the occurrence of high triglycerides and or high cholesterol. And these things mean a metabolic disease picture is taking place, whereby, once again, since insulin is not being sensed as we would like at the liver, the fat, and the muscles, we have more sugar floating around to be used in the body as a fuel source versus fat, and your liver decides to, hey, we got all those fats sitting around, we can't really make it into, we can't use it for energy, well, let's make it into cholesterol, let's make it into triglycerides. And so in a metabolic disease picture, before someone actually has type 2 diabetes, or they may only go as far as this and get better, by the way, and not progress to full-blown type 2 diabetes. They can have high blood pressure, have high triglycerides, have high cholesterol, and yet not have type 2 diabetes. Now, we used to think, well, it's just food, right? Or genetics, Well, mama had diabetes type 2, so it means I'm going to get it. Well, as you heard mentioned several times on the show now, over the last several months, on this suggestion of a genetic determinism, that means your genes determine your disease, we have found out that's false. We have found out there are things that control the genes called the epigenome or epigenetics. And things you do in your life can affect how the epigenome affects your genes and therefore turns things on, turns things off, and if you'll get diabetes or not. Again, more on a lifestyle and habits and, smoking and lack of exercise or, poor diet, all those being involved in causing those genes to be determined you do get type 2 diabetes. Okay? Now we're finding out that the type of foods that we're consuming literally can affect the type of environment that's growing and living inside your gastrointestinal tract, this little, micro world, a little microbiome of all kinds of bacteria. I mean, hundreds of trillion numbers of bacteria inside your GI tract. It's their own little world inside there, and finding that the foods that people are eating are affecting that environment are also leading to somehow play a factor in the immune system and how that gets involved if someone develops metabolic disease or develops type 2 diabetes. Your GI tract being involved in that. And yes, again, it's diet, but not in the way we ever expected. We always say, well, people are eating too much sugary food, so it really puts a hard time on the insulin secretion from the pancreas, disrupts the whole signaling pathway, and then we have type 2 diabetes. Well, it's not as simple as that, and in the body, things are never as simple as they seem, right? The body is a mysterious world that we're only beginning to learn a lot more about as time goes on. And so now we realize that literally the bacteria in your GI tract can affect your chances or worsen your type 2 diabetes. So I'd recommend anybody out there to consider learning more about healthy bacteria for your GI tract and start consuming foods at a minimum that are good for your gastrointestinal tract that promote healthy bacteria, such as fermented foods. Fermented soy products, for example, tofu, miso, natto. We also, of course, have sauerkraut. There's different types of yogurts. I'm not a huge fan. A lot of people eating lots of dairy, but yogurt tends to be a better one for a lot of people to consume. And a lot of these companies don't have a whole lot of bacteria in those things, and you got to eat quite a bit of these foods, but you're supporting that. And if you have a condition like type 2 diabetes or metabolic disease, you might want to consider actually talking with your provider about getting on a high strength or high dose type of probiotics for your gastrointestinal tract and see if you can further work more towards the cause of your disease than just treating symptoms. How about that one, huh? That's very interesting. I found that very, very interesting. Okay, so those are kind of the big ones from last week that we didn't kind of get to. Remember last week I had trouble with my iPad here and could not get into a certain document. Still can't get in that same document, so it's very strange. I was able to post it in a different pattern and get it sent to myself, and now I got it again. But that's a good stuff from last week. We got about 5 minutes here to the bottom of the hour. Let's get into a little bit of the new stuff, which we can talk about for this week. And let's talk about diets and cancer. And as you know, we're going to be beginning every show on here at 1020 AM, 95.5 FM, talking about cancer at some point in our medical show here. And diet is always a very interesting topic. And usually you always hear me talking about what type of diet should I be doing if I have cancer or want to prevent cancer. And usually I'm always saying low sugar diet, low sugar diet, low sugar diet, right? Sugar feeds tumors. Well, a study came out here, which I don't think has been posted in a journal yet. It's been received but not reviewed yet, entitled Vegetarian Diets and the Incidence of Cancer in Low-Risk Populations. And incidence means the occurrence out there of cancer. And they start off right off the background for the study that, cancer is the second leading cause of death in the U.S. The second leading cause of death in the U.S. That's not a good thing. That means we have to start beginning to continue to look at what can we do to prevent cancer from happening in the first place. And a very interesting factoid from this study is that they say dietary factors account for at least 30% of all cancers in Western countries. That's almost a third. So a dietary approach accounts for at least 30% of all cancers in Western countries. And therefore it comes down to a combination of how certain foods can be affecting our body. And in this study, the people here looked at an association with dietary patterns in people who weren't vegetarians, people who were lacto-vegetarians, people who were total vegans, people who were semi-vegetarians, and the overall occurrence of cancer in this group. And the study looked at 69,000 people, a lot of people. And they looked at all different types of cancers, not just one type. And the results were in that 70,000 or so that were followed, as they identified approximately 3,000 new cancers in those groups. And what we found out is that an overall cancer risk among vegetarians compared to non-vegetarians, there was a very statistical significant number of difference for both genders combined. And that the association was found that was for those on a vegetarian diet, their chances of getting cancer were decreased by 24%, 25%, a quarter. That's pretty big. And when looking at certain dietary specific vegetarian patterns, they even looked at those who were lacto-ovo-vegetarians, those consuming eggs, those consuming milk, and they still had about the same decreased risk of cancer, but only in regards to gastrointestinal cancers, colon cancer, for example, where in the total vegetarian diet there was a reduction in all cancers, a quarter across the entire board. And so obviously what we're gleaning from the study is that there is definitely a lower risk for those on a vegetarian diet than those on a non-vegetarian diet overall. Now, you might ask yourself, well, what do I eat? Well, I'm not a vegetarian. Okay, I'm not against it. I'm just not a vegetarian. I have tried to lay off meat for a period of time, and typically over a while I tend to get colder, and I really believe, to be honest, there's probably folks that go, man, this guy's, I don't believe it, but whatever. It's me, is that in Alaska in the winter, I need to eat some meat. Not a lot of meat, just some meat. And what I have strived to go after over the last a few years is eating less meat and more vegetables. It's balance. And I think if someone could do 2/3 vegetables or 2/3 vegetarian and a third meat, you're probably doing pretty good for most. And I know for some, everybody's different. There are some that can be vegetarians, and they've done phenomenal. They do great. They do fine. And I've seen those people around. They exist. Although I think it's hard to be a vegetarian in a cold climate. I really think it is. But here again is a study demonstrating that, again, how diet can affect, in this sense, your cancer risk. So for those that are just old meat eaters and no vegetables, just take this as a heedance that, is that a right word? Heed you that you should at least begin to add more vegetables into your diet. Dark green leafy vegetables specifically, be very precise. I don't mean lettuce, okay? All right? Collard greens, kale, broccoli, spinach, those sort of things. And remember, it's always important, too, to find out what are the types of vegetables that are lower in the amount of pesticides being sprayed on them. If you're going to try and eat healthy, eat things that have a low pesticide amount sprayed on them. You can visit a site online, the Environmental Working Group, or EWG.org, and print out a very simple sheet that will show you what are the best vegetables and fruits to buy when you cannot buy organic. In Alaska, well, it's a problem. All right, folks, it's a sign for our bottom of the hour break. We'll be back in about 5 minutes. Hold on there.
And the reason that you had to care, the traffic is stuck, and you're not moving anywhere. You thought you found a friend to take you out of this place, someone you could lend a hand in return for grace. It's a beautiful day.
Hi there, folks. This is Dr. Ellenburg. Welcome back to our medical show here on Fox News Talk 1020 AM, 95.5 FM. You can find us online as well at foxnewskoan.com. That's foxnewskoan.com. You can live stream us. All righty, let's get back to today's show here. We got a bunch of things still to go over here today as well, so we'll get right into that. So you hear me talk a lot on here about an acid and an alkaline diet, and for the sake of reading myself again, which is fine, I think, and talking about acid and alkaline diets, is important to understand a few basic things about what that means. First of all, the pH scale is how you measure acid and alkalinity of anything. And the pH scale goes from 1 to 14, and where 7 basically is neutral, and 7 is about what water's at typically. In the human body, we get a range of pHs in a variety of places. One of the most dramatic ones is in your stomach, where the pH can get as low as almost 2, slightly under 2, 1 to 3, literally for a very acidic environment for digesting food. It gets that low for a reason as well, to help kill off any things that might be in your food that are going to make you sick, okay, that are as far as pathogens. Now in your blood, way different story in the pH. It's a lot higher, and it's right in a very tight range. And the blood pH is about 7.2, 7.3, 7.45. So very, very middle of the road range. Your urine can have a variance of pH anywhere from 5 to even up to 9. So the most alkaline area in your body typically might be your urine, okay? And that kind of segues into talking about the study that came out, which may not apply to a lot of you out there, but it kind of brings home the comment again that what can the benefit of an alkaline diet do for me? And what that means is consuming foods that create an alkaline environment, in this case, in the urine. And things are not always what they seem as far as alkaline foods. For example, I'll give you some things you think about. Lemons, which you all consider quite acidic. Lemons, even though they're acidic, create an alkaline environment in the body, okay? Whereby, for example, a steak would make a very acidic environment in the body. And not all vegetables, by the way, are alkaline. And the best thing to do, if you're curious about that, there's books out there on this topic, lots of books on this topic, as a matter of fact. But also online, there's a lot of free printouts you can get in a variety of places that show an acid and alkaline diet. And we frequently hand it out to our patients in our practice to have them look at foods to get a better idea how to make more alkaline environments in their body. And those are good for things like inflammation. People who have more acidic urine tend to have more inflammation in their body. The more acidic the nature there is in their urine, they are in more pain, typically. So getting them alkaline, these patients, they have less pain just by doing that, not even taking a pill in this case. One example. And in a lot of cancer patients, cancer typically tends to like a more acidic environment. And so we have a belief as well that making a body more alkaline might have a way of fighting back against cancer. And we know for a fact that more alkalinity in the body can help decrease inflammation. So in a sense, that should help out cancer. Well, should be a negative towards cancer, because cancer loves inflammation. So if we can lower inflammation in the body of someone with cancer, hopefully we can improve their prognosis overall as well. And so a study that was presented at the American Society of Nephrology 45th annual meeting was presented earlier this month. Nephrology is a study for kidney disease and is entitled Acid Reducing Diet Slows Kidney Damage. And one of the hardest things to treat, I think, in medicine is somebody who has compromised kidney function or chronic kidney disease, or CKD for short. Ask any nephrologist out there. It can be very, very hard to treat these patients. And a lot of them end up on dialysis of some type for a long time until the end of their life. And the reasons becomes a huge issue is if your kidneys filter all your blood and they filter out waste from your system. So you don't keep it in your system. You want to get rid of it and you pee it out. Well, if we don't do that, we accumulate things like phosphorus, we accumulate things like ammonia and other contaminants that go back into our body and cause a lot of health problems. And in this particular study, patients who had high blood pressure, associated kidney disease, and who had reduced filtration rate in their kidneys, known as glomerular filtration rate, or GFR, had improvement by switching their intake of dietary acidic foods to more base or more alkaline-inducing foods such as fruits and vegetables, or even bicarbonate, or baking soda for that matter. And this is one of the first and one way of looking at your kind of idea of where your blood's at, as far as, not your blood in this case, but are you more acid or alkaline? Besides the urine, you can also look at what's called a plasma total CO2, or CO2, which is typically ran on a metabolic panel. And people, numbers that are above, the range usually goes from anywhere from about 21 to roughly around, I think, 30, I want to say, as far as a reference range on a lab test. And anybody above 24, they're suggesting here you have more of a normal acid-base balance. And if you're below 22, you have more acidity in your system. And so, again, people in the study were given either fruits and vegetables or bicarbonate or nothing. That was a control group. And to look at, to see if their kidney function improved and if they had any improvement in their high blood pressure, known as hypertension, or any decrease in urine protein excretion, because when your kidneys filter things out, if they're damaged, the filter's damaged, you'll have some protein show up in the urine and can be measured on a dipstick test or a urine culture. What were results? Well, what we found here in the study is that we had just different groups, one that had fruit and vegetables, ones that were to receive bicarbonate, and then ones that had a regular diet. And so what we found out is that the acid load for the kidneys was actually reduced by almost 50% by an acid alkaline diet. It's pretty impressive. And reduced about the same amount by those taking baking soda. And at 3 years, all groups, including the control group here, experienced a decrease in overall systolic blood pressure. That means that's the top number of your blood pressure, from approximately 157 to 166. And in the control group, it was about a point less and a lower number. And the filtration rate of kidneys as well improved in those receiving bicarbonate and those taking and consuming fruits and vegetables. And so what we found out from the study basically is, and again, the study was done in patients who had, high blood pressure, have kidney disease, so they're put in a very interesting group with a name called hypertensive nephropathy, and basically kidney disease and high blood pressure as part of their problems. And those who had moderate, as they put it here, metabolic acidosis, they had improvement by consuming foods that were in higher alkaline contents or promote alkaline environments in the body with fruits and vegetables. And again, not all fruits and vegetables do that. Go online, print out these things. They actually can be helpful in trying to figure out what type of foods to be consuming to make you more alkaline. Obviously, besides baking soda, many people now have water ionizers that they have in their homes. I have one at my office, as a matter of fact, that make alkaline water. And they can, in this case, we're taking city water and filtering it through 2 different filters, cleaning it up and making it alkaline. And yes, I've had it tested independently to make sure that the machine I do have does make good water. And it does. So I'm happy to see that. So a very real-life acid alkaline study here demonstrating that, again, there's benefit by consuming a more alkaline diet. Getting back to the vegetarian diet we talked about earlier today, for cancer prevention, that could be another piece we find out with that same diet is you're on a diet that makes you more alkaline, gives it less inflammation, a more slightly alkaline environment in your body as a whole, may not be the best place for cancer to grow in. Interesting. All right, folks, we tuned today is Dr. Michael Ellenburg. So, medical show here on Fox News Talk 1020 AM, 95.5 FM. You can find us online as well at foxnewskoan.com. That's foxnewskoan.com. Check us out. All right, well, let's talk about a topic here today, which is new to me. So bear with me in describing this to you, but I'll do my best. And that is about something called nanoparticles in food. And as posted in the most recent, what's called the Environmental Magazine November-December issue. And it's talking about a variety of articles that are discussing nanoparticles that are found in our food supply. Well, what are they used for in the first place in food? That's some things they mentioned here in the article. One is by adding them to foods for food packaging. They can help deliver nutrients. They act as thickening agents. They can be used to enhance taste or flavor or ensure longer freshness of food. And these different types of nanoparticles, and nano typically we're talking about something that's like 10 to the negative 10th as far as like size. So nano, I mean super small. If anybody out there has read the book by Crichton called Micro World, we're talking about that world. Okay, it's super, super tiny. And in this world, we're talking about using various metallic, typically, elements such as silver, zinc, titanium, and even copper. And what our concern is that since they're in a very microscopic size, nano size, N-A-N-O size, may they or could they possibly lead to causing adverse health impacts? And it kind of goes along the same line of being concerned about these genetically modified organisms or GM foods that have been genetically modified to do certain things out in the environment for harvesting. And that definitely has caused some impacts on patients' health and can cause allergies, has caused a lot of problems in livestock that eat these sort of things. So we know there's a problem monkeying around with the food supply. So again, it's the same place with GM foods where a lot of research is not being done in advance with animal populations or to see if they actually would harm them or not. No one is doing this research on animals with these nanoparticles to see if there's any harm coming from. We're just starting to see these studies kind of slowly come out. So there's concerns for that. And, the FDA really doesn't even have any type of a great system to follow this. And as we're being described here in the e-magazine, it says right here from the FDA does not maintain a list of foods that contain nanomaterials, so they cannot answer any questions about those. And as a spokesperson at the FDA said that. So something using our food, know nothing about what's the FDA being used for. Food, Drug Administration? Come on, guys, food. And again, there's some concerns. Now, some of you might say, well, I heard that silver, for example, like nano silver, can be used for health problems, like it's antimicrobial, so it's good against infections or viruses, bacteria. Yes, it is. And what seems to be coming out of the data on nano silver, it does not tend to collect in the body in any way we can currently measure it that we're aware of, which is good, which is very good. And, so is nano silver a problem for us? At this point in time, looks like the answer is no. Doesn't mean you should take it every single day, for that matter. But colloidal silver and nano silver are not the same thing. Colloidal silver is kind of an encompassing group for all different types of colloidal silver being made, where nano silver is a specific type of colloidal silver being made. So all colloidal silver is not created equal. If you're going to use silver for any type of a health thing, look at nano silver as a better choice as far as its usefulness and not staying in your body, where other colloidal type silver products might. That could be a long-term concern. So nanoparticles besides food are also used to purify water. We mentioned being used in food as anti-caking, thickening agents, and in packaging to protect against UV light exposure and preventing growth of various things on our food while sitting away for us to buy it at the market. And for another example, in toothpaste, you have titanium dioxide being used, which is also used in certain foods as well. So we have titanium dioxide used in Mentos, Trident and Dentine gum, M&Ms, Betty Crocker whipped cream frosting, Jello banana cream pudding, Pop-Tarts, and Nestle's original coffee creamer, where you're going to find some titanium dioxide in there. And it's more for color, okay? It's not good for you. It has no health benefits whatsoever we're aware of. It's just there for color, okay? Processed food. A reason to not eat or consume processed food, right? So that's a concern. And then beyond that concern is that we're using these things in the environment. They're being used in humans in a sense of or consuming them in food products and then ending up in bio-waste into water treatment plants and going back into the environment in some form or fashion. We've already talked before on the show a long time ago, but before we can find a fair amount in some bigger cities in water aquifers. They're beginning to find certain amounts of drugs, pharmaceutical drugs from humans, right? Going back into the world and back up in our water, and we're drinking them. Not being put there on purpose. They're in it there in indirect method, that's for sure. So we're concerned about that. And one study that was done here, looks like in 2008, was looking at inhaled copper nanoparticles that increase the risk of infections in the lungs of mice. Okay? Now, mind you, they're way smaller than we are, but it's a concern. I mean, obviously it caused a problem in them. And due to this, and with a very, very small size, they can pass into the bloodstream very easily and then accumulate in organs over a period of time, depending on what they are. And we're hoping to see more research. So if you have a chance in your time, look up and read more about nanoparticles. This article did appear in the emagazine.com, E as in Ellenburg, emagazine.com, 2012 issue, December, November of this year. So nanoparticles, concern for sure. All right. Well, I've got about 10 minutes left in today's show. If you have questions about your health or questions about our topics today, give us a call here at 522-1020. It's 522-1020. Okay, we'll wait for our callers here. We'll move on and cover a few more of our topics. One that's important, I think deserves some attention, is a recent article that appeared in the Canadian Journal of Psychiatry entitled Omega-3s may reduce postpartum depression. What is postpartum depression? Postpartum depression is women who get the baby blues, as they might be called, or depression after pregnancy. And this article is great because it gets right into the thick of it. And research was done at the Montreal Research Center at St. Justine Mother and Child Hospital. But mother omega-3 levels were decreased during pregnancy and remained lower for at least 6 weeks following birth. And they're saying from the information in the study, women are at a higher risk of depression during childbearing years, and a birth of a child may trigger a depressive episode in women who are vulnerable. And we're concerned about their omega-3 fatty acid levels. Why are we concerned about the levels? Well, for example, EPA and DHA Omega-3 fatty acids found in krill oil and fish oil. EPA and DHA are very high in the brain. Remember, our brain has a lot of fat. I told you earlier today, a quarter of all the cholesterol in your entire body is found in your brain. So the brain is made up of a lot of fat, and a lot of that fat is omega-3 fatty acids. And when a woman has a child, as you know, if you're a woman out there who's had a child, you're a vessel, right? You're growing that baby inside you, and whatever you have on board as far as the ingredients needed to help that child grow well are coming from you. Vitamin D is coming from you. Iodine is coming from you. Omega-3 fatty acids are coming from you. And if those are used up, and furthermore, once you're breastfeeding, if you do after you've had a child, you're also going to be losing omega-3 fatty acid levels into the breast milk as well. So it can further exacerbate a woman who has low levels of omega-3 fatty acids. And therefore it becomes important to consider taking that while you're pregnant. As a matter of fact, it's not a bad idea at all. And taking it after you're pregnant as well. And any women who are having trouble with postpartum depression, it's important to consider and look at things besides omega-3 fatty acids, also iodine, even having a thyroid evaluation. Many women who have children have problems with thyroid function, becomes hypo or under-functioning after pregnancy. And again, have vitamin D levels looked at as well as an important part of that. We've got a caller on line one. Jim, are you there?
Yes, I am. I was going to ask you, I have an elderly friend, let's say she's 70 plus, and she has had diabetes for about 20 years plus. She takes a medicine called metformin.
Yes.
And she takes 2 500-milligram tablets twice a day, and it's not helping her anymore. She has made an appointment with your office to have a checkup with you, I guess. And I was just kind of wondering what kind of treatments might she be looking at, or what kind of, and also what kind of information maybe should she want to bring with her to your to her first visit. And I'd just like to hang up and listen. Would that be okay?
That's fine, Jim. Thanks for the call.
All right, bye.
Okay. Yeah, I guess the biggest thing, the quick one is what to bring with you as a patient at any clinic, besides my clinic as well, is you want to bring past lab work. Always important for your provider to see, and lab work you've had done in the last year or two. Always very helpful. And if you have any type of other problems in your body, such as you need a CAT scan or an MRI or even ultrasound, it's good to bring copies of that information as a report with you. That's some of the big things to bring along with you. And the third thing in my group would be if people are taking, of course, prescription drugs, usually bringing a list of those things anyways, but on top of that list is what type of supplements is that person taking, and what are they and what amounts. And typically they'll bring in a little satchel of stuff or a bag or a box, so they're taking, and we'll go through those things at a visit to see what's helpful and what's not. Now, with type 2 diabetes, we discussed earlier in today's show about that having very many facets to it. And when someone's taking metformin, a prescription drug been on the market for a very long time, and can be very effective, is that those drugs are trying to basically enhance a patient's insulin sensitivity. And metformin can do that at times. And a lot of times, as people have diabetes a long time, if they're not addressing the underlying causes of diabetes, they end up having to increase their dosages of medications as they age, as they get older. And so we look at a lot of patients is how can we, better help the body sense insulin. And so with that, we look at trace minerals, for example, such as vanadium, chromium. And these are trace minerals that are involved in a factor in the body called glucose tolerance factor, or GTF. And it can help improve that. In fact, a lot of patients who have diabetes, I would suggest they're low in trace minerals, they're low in chromium. And your body uses quite a bit of that. And I've seen patients who even aren't diabetic or have higher blood sugar or even have low blood sugar help by taking certain amounts of chromium. So there's one thing that would definitely help out. Vanadium, I mentioned that already. And now I'm going to be talking to all my diabetic patients and talking to them about getting on some type of a probiotic with a higher dose. Now that we're seeing data come out suggesting that the bacteria in your GI tract has an effect on your insulin sensitivity in your body, we need to start working in that direction as well. So treating the GI tract as well will also be part of that system. And, of course, making sure the patient is exercising, because that's number one on the list for helping your body sense insulin better, and on a good diet that is low in sugar, right? We want to have those patients taking foods, consuming foods that are not going to are not going to artificially help raise their blood sugar higher than these two often, because they're on foods that have a high glycemic index. So that's kind of some of the big things in a way of approaching this that help that. And the biggest thing is seeing where patients are at and how bad things are and where to go from there. And, oddly enough, one thing I can't help but mention about metformin is we're now beginning to see a handful of studies talking about the use of metformin in treating cancer. Because, and I don't know the exact mechanism of action, how that might be helpful, but it seems, again, to have an ability to, one, if it's going to help patients' insulin sensitivity improve, that may be a benefit in itself for those patients. And maybe it has some type of an involvement in the way that the tumor cells are using glucose as a fermentation to create energy. It may have a hand in that somehow. But metformin is a very interesting drug, but market quite a long time. But thanks, Jim, for your call, and that's about how I would begin approaching that with a patient. We've got about 3 minutes left. Let's just go over a few things here, and we'll end our show for today. A couple of comments. Let's see. I want to say that for next time. We'll get this one here. Let's talk about the one article I didn't get a chance to say much about. And it's a real short one from last week's show that I didn't have available at the time, and that is an article from the United Kingdom. And what's going to be happening this year, and it started in the UK, United Kingdom, England, folks, is they're going to be putting a health warning on mobile phones. And mobile phones in the United Kingdom will come with a government health warning that comes from the officials from the Department of Health in the UK to let them know that people should limit, specifically kids. They'll advise parents to ensure that children under age 16 limit their use of mobile phones to essential calls, and that younger they are, less time they should spend talking on them. And this move comes after ministers accepted recommendations from a scientist called Sir William Stewart, the former government chief scientist who chaired a comprehensive inquiry into all the available science. And a quote from the article, he said that while there is no proof yet that mobile phones could damage health, scientists have discovered subtle biological effects which might prove harmful in the future. That guy should be a politician, what he writes. So what we're saying there again, and this is not new, I haven't discussed this in a while here on the show, but cell phones, make your head feel a certain way. If you're talking on a cell phone for half an hour, if you don't feel something odd when you get off the phone, you're not paying attention to your body very much. Maybe you've been so used to it's the way that it is, but you're getting radiation from your phone. Electromagnetic frequencies, or EMFs. They're real things. And if you're in a car talking on your cell phone, you shouldn't talk on the phone in the car in the first place. It saves a lot of time and accidents and all kinds of hazards on the road. But while you're on the car talking, that cell phone is trying to catch up with the nearest cell phone tower. So it's having to attenuate its signal and increase its output of EMFs to actually grab that signal so you can hear your phone call taking place. Where we're seeing we're talking on the phone, way safer and less radiation taking place. But with children, it's a huge deal. And they say here in an article, they have thinner skulls than we have. Okay? And that makes a difference. And we're going to find out more and more about this. But if you do have children, please limit their use on a cell phone. At a minimum, texting is not going to harm them that we're worried of currently on their fingers, but definitely decrease their radiation exposure for being young children and their brains still developing. All right, folks, thanks for tuning in today. And our show, we're here, of course, on Mondays from 2 to 3 p.m. And during the week, you'll find me at the Ellenburg Center for Natural Medicine. Our phone number is 563-2366. Our website address is drellenburg.com. That's drellenburg.com. Remember, Ellenburg with a U. Take care. Have a great week.
Or you can cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on a new train, far away from this world of pain. And when you look out your window, you'll see you're home.